Good evening. Thanks for joining us. You're about to meet a dedicated team of doctors operating against the clock under suboptimal conditions. Of course, performing brain surgery on children is already stressful, but spending your vacations doing it for free in developing countries, that's next level stuff. Their goal, nothing short of a medical revolution. Here's ABC's Mariana Van Zeller.
A world away from the high-tech hospitals they're used to.
This place is a trip, man.
Two American brain surgeons
Keep going.
on an extraordinary mission.
You learn an extraordinary skill. It can't be just for the rich.
7 surgeries in just 48 hours.
You put in your best effort, but sometimes that's not good enough.
With children's lives in the balance, the stakes couldn't be higher. We first meet Dr. Rahul Jandial at one of the premier cancer centers in Los Angeles.
Lots of stitches.
Why did you choose neurosurgery?
I'm still choosing neurosurgery. We're pioneering neurosurgical techniques here. We're discovering science here.
That's neuronavigation. It's standard now in American centers.
It's a stark contrast from the focus of his upcoming mission.
How does this hospital compare to Peru, where you go?
It's a world of difference. I mean, we have every device and instrument and monitoring technique that's available in the world. And over there, they have to manage with very few resources. Hi there.
It's a grim reality that might discourage some, but has only served to motivate Dr. Jandial.
Tomorrow we'll wake him up, okay?
He created a foundation called Inca, and for 13 years, he has dedicated much of his free time to build and renovate children's brain surgery programs in developing countries.
All right. These are things that we're going to get refurbished or throw away, and the City of Hope Cancer Center, they knew we were headed to Lima, so they decided to donate them. These are the delicate suctions that we use so you don't suck up brain.
Dr. Jandial's goal is to empower the local doctors to perform life-saving brain surgeries on their own.
This is the Maria Auxiliadora Hospital. It's a charity hospital. It services up to 2 million people in one of the poorest areas in Lima.
¿Cómo estás?
This is for you, doctor.
It's like when Mike Levy and I first showed up here, we were like this. I'm not sure I've been to a place where there are incomplete mud huts and buildings outside of a hospital. It just feels good that they're providing the real care for the people.
This is a passion shared by Dr. Mike Levy, the chief of neurosurgery at Children's Hospital San Diego.
Well, I like it here.
Why pediatric neurosurgery?
It's the way to make the biggest impact. Giving a child in a country with less resources their full faculties, if you will.
As it turns out, the poorest 30% of the world's population receives only 3.5% of all surgeries.
This is all for you guys, for the hospital.
Those hand-me-down tools bring smiles. Here, nothing is taken for granted.
It's a huge help for a struggling hospital.
For the next 4 days, Dr. Jandial and Dr. Levy will work with this team of Peruvian neurosurgeons. Their first patient is Frederick. On the outside, he's the picture of a healthy toddler. But inside, there's a ticking time bomb, a brain hemorrhage.
Is it challenging to work with a team that you've never worked with before?
We have an international language for neurosurgery. So we're having to use old-fashioned tricks like how high is it above the ear, counting centimeters, how far forward is it from the middle of your head. That's the way to triangulate where we think this artery is and that exploded.
Frederick's surgery is a success.
You were the only neurosurgeon here when you started.
Dr. Victor Benyoch-Kikwer has fought to build up the neurosurgery program for 30 years.
Why a charity hospital and why not private practice?
Es mi compromiso como médico.
When I decided to become a doctor, it was to work for the people in the poorest area of Lima.
In the States, neurosurgeons are in the 1% of income earners. Here, neurosurgeons are middle class in a poor country. The sacrifice is on a scale that doesn't compare to what we're doing in the States.
Which is why Dr. Jandial doesn't want to waste a minute of his time while he's here. In the ICU, another child waiting for surgery. Just 2 days ago, a tumor was discovered in the center of Manuel's brain.
¿Cuántos años tiene? 11 años. Yo tengo un hijo con 11 años. I have an 11-year-old son.
What is the condition of the kid?
Well, he's awake and talking, and he's moving his arms and legs, so that's actually pretty good. But the tumor is in the center of the brain, and the nerves pass right by it.
Based on the scans, they believe that Manuel's tumor is benign, but the surgery itself is long and risky.
It could be anywhere from 5 to 7 hours.
This is the tumor.
Wow.
You can see these little branches right here. Those are the main carotid arteries coming into the brain. So it's saddling the two main arteries coming into the brain.
In the room, 2 Peruvian neurosurgeons and half a dozen residents, observing Dr. Levy's every maneuver.
In this case, the patient's in trusted hands. Then it's more about the fate that's already decided and what kind of tumor it is. You just have to go figure that out.
It's been 3 hours. Manuel's mother is anxiously waiting for news.
She's saying there's nothing in the world that she wishes more right now than to be able to see him and hug him.
But an hour later, a humbling discovery.
I think it's an optic nerve glioma. Biopsy forceps. Here we go, specimen. So let's see a send and have pathology look at that.
The boy's situation just got worse. We think it's a glioma, which is a worse type of brain cancer to have. You know, it changes the goal of the operation. If it were a certain type of cancer, we try to get it all out. So we take what we can safely. Nightmare for him and his mom is just beginning.
The pathology test results return, confirming that the tumor is in fact malignant.
So there's no surgery we can do at this point. That's unfortunate.
5 hours of surgery are of little help for Manuel. He will have to undergo chemo and radiation.
How do you feel about the outcome?
I feel pretty about it just because there's nothing I can do surgically to change his life in a positive fashion. It's not good news because I don't know how much life we're going to buy him. It's just a big letdown because we're trained to do things to fix things. There's nothing we can do to fix him. There's no fairness in that, no matter where it is. There's no fairness in a young boy losing his life from a tumor. The tumor was coming out of the nerves he sees.
What is it like having to go to one mom and you know that the outcome is not going to be great?
The people that you don't want to talk to because you have no good news for them are the people that you need to spend the most time with. It's never easy.
And at the close of this long day, another difficult conversation. Maria has been waiting for her son to have surgery for months.
This soft is like the world's biggest soft spot.
16-month-old Liam fell from the second story of their building, fracturing his skull. She says she only looked away for a minute.
Después veniste al hospital.
Doctors tell Liam's mother that there's not enough time left in the day. His operation will have to wait until tomorrow.
She's devastated by the news. She said he hasn't eaten anything since yesterday. He's been crying, and she just wants to get it over with.
A mother's guilt comes pouring out.
You can't pick your days. Today there's good news and bad news. Take the good and try to deal with it.
It's a new day. Manuel and Frederick are in recovery, but little Liam is waiting.
Took a moment this morning to think about the kids from yesterday. Took another moment to think about the kids today. Keep going.
Today he will finally have the missing piece of his skull put back in place.
So we have to reopen the previous incision, make a giant flap, expose the surface of the brain, and then try to drop a piece of skull on and reconstitute that. That's the skull that they took off.
After 2 hours, the surgery is complete.
The doctor was saying that it went incredibly well, and he's really happy with this one. You can see he's moving his legs already.
He's a This is awesome.
This is really good news, right? That he's kicking.
The fighting and the resistance, that's good. For neurosurgeons, that's the best thing.
The wait is finally over for Liam's mother. Liam is one of the lucky ones.
She's saying that you can notice how his head is round again.
You know, on to the next battleship, on to the next hospital.
For Nightline, I'm Mariana Van Zeller in Lima, Peru.
Remarkable. Our thanks to Mariana for that report.